Waiguru Ka Khalsa, So my name's Kira and I'm here today to talk to you guys about mental health and mental illness in our community. I'm going to start off by kind of going through quite a few of the mental illnesses and kind of trying to explain them. I am a bit nervous, so if I'm kind of talking too fast, just kind of stop me and then I'll try and go through it in more detail. So I want to ask you guys what you guys think mental health and mental illness is, and if there's a difference, or do you guys think it's the same?
Is mental illness when you're psychologically harmed, whereas mental health is like your body, and if there's any issues with that?
Yeah, that's great, yeah. Thank you. Anyone else? Or? Okay. So mental health. The terms mental health and mental illness are used interchangeably, but they actually have two different meanings. Everyone has mental health, and we should look after our mental health just as we look after our physical health. So some factors that can stress our mental health are traumatic life events, stress, social economic status, alcohol and drug abuse, family structure, and different cultural norms. Whereas mental illness consists of dysfunctional behaviours, thoughts or emotions that occur often and interrupt daily functioning. So anyone can develop a mental illness, but not everyone has a mental illness. So anyone can have a mental illness regardless of gender, age, culture or religious background. And just some examples are depression, anxiety disorder, personality disorder, bipolar, OCD. But these are just some of them. There's like loads, just as there are loads of physical illnesses. So we're going to talk first about low mood and depression. Low mood doesn't always mean you have depression, and it's okay not to feel okay. Everyone has their down days and everyone has their good days. So low mood can consist of feeling some or all of the following: so fed up, really sad, fatigue, angry, anxious, and having like very low self-esteem. Some causes of low mood can consist of lack of sleep, keeping your feelings bottled up, stress, social pressures, loss of a loved one, and hormonal changes, and that's in both female and male, alcohol and drugs as well. So with low mood, it usually improves within a couple of weeks, in a couple of days, and it can be improved when something positive takes place. So for example, if you're feeling really stressed with uni exams and you're feeling really down, but if you take the time out and spend some time with your family or friends, your mood will start to get much better. So feelings of low mood should start to decrease and go within 2 weeks or even a couple of days. But whereas depression, it has all the symptoms of low mood, but usually low mood continues beyond the 2 weeks. There's also added feelings of hopelessness, emptiness, a loss of interest in your hobbies, a lack of concentration, either sleeping too much or too little, self-harming and suicidal thoughts. And if you self-harm or have suicidal thoughts, it's vital to speak up about it. And you should remember there's no shame about speaking up. And this could be to a family member, a friend, or even us here at Sikh Youth. And along with this, you should seek professional psychological help. So some factors that increase your chance of depression, it doesn't mean it will cause the depression, but it will increase the chance. So childhood trauma, physical abuse, sexual abuse, rape, loss of a loved one, genetics, substance abuse, extreme stress, and that could be from like work or your personal life, physical illness and feeling isolated. So some ways to cope with low mood and depression: sleep is really important, and we should be getting at least 7 to 9 hours of sleep every night. And to do this, we can try and put our electronic devices away at least an hour before sleeping. And showering 90 minutes before sleeping also helps you sleep well throughout the night. And a reduction in caffeine and alcohol, regular exercise, because a healthy body is a healthy mind. And again, talking is so important. I'm going to keep repeating this probably with every slide, but it's really, really important to talk and never keep your feelings bottled up. Talk about how you're feeling, no matter how small or big the problem is. There is someone out there that cares. reaching out is the strongest thing you can do. And again, it's so important to reach out for professional help, and you can do this by referring yourself to a psychological service or contacting your GP, and they'll kind of put you in the right direction. So GAD, so everyone feels anxious in their lifetime. This doesn't mean you have a mental illness. So for example, like right now I'm really anxious doing a presentation or when you do an exam or a job interview. However, individuals will find it difficult to control their anxiety, and if it's impacting their overall well-being, this could be GAD. For example, someone's anxiety getting that bad they can't leave the house and get in their car to get to work because they think they're going to have a car accident. So individuals with GAD find it extremely difficult to relax and constantly worry and feel anxious about different aspects in their life. So they'll have one anxious thought, it'll enter their mind, they'll kind of try and solve it, but once they've solved it, another anxious thought will enter their mind, and this is a vicious cycle. So you also get some physical symptoms with this, and this can include dizziness, fatigue, lack of concentration, and difficulty sleeping. So some factors that can cause GAD is an imbalance of the different chemicals in your brain, and you're more likely to develop this if your parents have been diagnosed, or some kind of childhood trauma, abuse, or substance misuse. So panic disorder, this is a sensation you get when you're in a stressful and intense. Feeling the sensation of panic in a stressful and intense event is normal. However, if the sensation occurs in everyday situations which are not as stressful, this could be a panic disorder. So say you're in an exam, it's so natural to panic, but in like other non-stressful situations, it's not normal to kind of panic. Panic attacks are when individuals have an intense feeling of uneasiness, and this can be really distressing for the individual. So some of these symptoms are a racing heart, feeling like you might faint, but it's actually very rare to faint because the blood pressure increases when you're panicking, but to faint, your blood pressure needs to decrease. Chest pain, sickness, sweating, hot and cold flushes, shaking, dizziness, pins and needles in your hands and feet, like a high-pitched ringing noise in the ears, and an intense fear of dying, an upset stomach, and dissociating, and that's when you kind of detach from your body and your surroundings. And those usually with a panic disorder, they panic when they're having a panic attack, and they kind of panic about the panic attack, so it kind of makes it much worse. So some factors that can cause panic attacks are traumatic life events, abuse, PTSD, which we'll talk about a bit later, genetics, and again, imbalance of chemicals in the brain. So coping with anxiety and panic attacks, the main thing to do if you experience this is to just slow down, take slow deep breaths and calm yourself down. Just kind of acknowledge these feelings you're experiencing and ride the wave of the sensations you're experiencing, but again, remember to take deep breaths and calm yourself down. Regular exercise can help too, and again, the reduction of alcohol and caffeine, because caffeine raises your heart rate anyway, and if you're drinking cups and cups of coffee each day, your heart's going to be racing already, and if you have panic attacks on top of that, your heart rate's going to be like 10 times worse. So again, the best thing you can do is, if you're feeling anxious, is to talk about how you're feeling. And the key bit is, if anxiety or any of these symptoms are affecting your quality of life, it's vital to seek professional help. And these professional services usually use psychological talking therapies, which we'll talk about later. And remember, your panic attacks won't kill you. Even as much as it feels like they're going to kill you, they won't. So PTSD, it kind of goes hand in hand with anxiety. So individuals who experience PTSD uncontrollably relive their traumatic experiences such as rape, abuse, terrorist attack, violent muggings, witnessing a traumatic event, and this could even be like domestic abuse within the household, and natural disasters such as earthquake and floods. So some symptoms of PTSD can consist of all or some of the following: so flashbacks to kind of think about the situation and they feel as if they're in that previous situation in the present moment. Nightmares, unable to sleep, lack of concentration, frequent uncomfortable sensations, joint pain, sweating, trembling and feeling sick. And they really have a difficult time accepting what has happened in their life. They kind of try and avoid certain situations, such as people, places and smells, because these can kind of bring back the traumatic event they've been through. So for example, say if someone's been through rape and the perpetrator was wearing a certain kind of fragrance, and imagine now this girl is walking through town and this, someone else has this same fragrance on, and that smell kind of triggers a flashback, and she could act out by screaming and shouting because she feels as if she's been taken back to that moment. So avoiding certain situations increases the likeliness of being isolated because they're not going to be interacting with their family and friends. So the fight or flight response, also known as hyperarousal, is when the mind detects danger, so it goes into a state of high alert. But individuals with PTSD usually experience hyperarousal often as they're easily startled and anxious about the threats that they may be exposed to. It's kind of like they're waiting for something to happen, something bad to happen constantly. Individuals that experience hyperarousal usually display this through different emotions such as anger. So coping with PTSD. Symptoms of PTSD can start to develop straight after, a couple of days, but even years later after the traumatic experience. Every individual is different, and not everyone that's experienced something traumatic is going to experience PTSD. They might have symptoms of it, but they might disappear after, say, a couple of weeks. And it's completely normal to feel upset and angry after experiencing something traumatic. If the individual's mood or feelings don't start to improve after a few weeks, you need to seek that professional psychological help. And again, remember talking about the traumatic experience with a family member, friend, colleague, even with us here at Sikh Youth UK. It can really help the way you're feeling. And talking therapies such as cognitive behavioural therapy and EMDR are mainly used for trauma work.
What's EMDR stand for?
It's eye movement, desensitisation and reprocessing. The kind of the therapist uses the movement of their hands.
Right.
And I'm not too OCD. So OCD is split into two main parts: obsessions and compulsions. Obsessions are the unwanted thoughts or images that enter the individual's mind, and they're really difficult to control, and most of the time they are really negative. So the individual feels a lot of disgust, shame and distress towards themselves. So then the compulsions, the second part of OCD, is the excessive repetitive behaviours that give a short amount of relief from the unpleasant feelings that the individual experiences. So the following will increase the risk of developing OCD. Genetics, too much activity in the brain, not enough chemicals in the brain, and the key one here is serotonin. Negative life events such as bullying, physical illness, abuse, neglect, loss of a loved one, and you'll find with most of these mental illnesses, like traumatic experiences are the main cause of these. Not always, but in most cases. So for example, someone who has an extreme fear of the house burning down, so before leaving the house they have to go around the house about say 10 times just to check every single appliance is off. And this can have an effect on your work and university life because it will obviously make you late getting there. So coping with OCD, and this is so key with all of these mental illnesses, there's nothing at all to be embarrassed of. Just speak up, talk to someone again about the thoughts you're experiencing. OCD is unlikely to get better by itself. You can try and do things to improve your symptoms, but they will not go through professional treatment. Again, refer yourself to a psychological service or tell your GP who can refer you. Therapy and medication usually helps, but therapy in this case is usually more effective, but obviously this depends on the individual as well. So BPD, there are different personality disorders, but BPD is the most common. BPD consists mainly of individuals not being able to regulate their emotions and finding it difficult to keep and maintain healthy relationships. So there are 4 main parts to this. So the first one, dysregulation of emotions. So these are very intense negative emotions such as anger and shame, and even loneliness. Individuals could feel very suicidal, but a couple of minutes or hours later their suicidal thoughts can go and they kind of go back to their baseline and are kind of their normal selves again. Negative thoughts and hallucinations. So thoughts about not being good enough and that you're a bad person, and hallucinations are voices outside your head that you think you can hear but they're actually not there. So for an example, the hallucinations could be telling the individual their friend is going to kill them, or the voice could be telling the individual to hurt themselves, to harm themselves or to kill themselves. Impulsive behaviours. So there's 2 main types which are both difficult to control. So there's the impulse to harm yourself, and there's also the impulse to take part in reckless behaviour, so excessive spending and gambling, and obviously the excessive use of drugs and alcohol. And then the last bit of this is unstable relationships. So this is the frequent fear of being abandoned by your friends or family, and this can lead to anxiety and extreme anger. And then the other end of this is some individuals feel as if those around them are too controlling, and there's no in between. So sometimes this can create a love and hate relationship between the individual and the people around them.
Sorry, just could you go back a minute?
Yeah.
On the last bit, there's some factors that could increase the chance of BPD with BPDs.
Yeah.
So is that serotonin like the hormone that's released in the brain? Is that?
Yeah, it's a chemical in the brain. So
Right.
if there's an imbalance, it can create really intense emotions. Yeah. Coping with BPD. Again, it's important to talk about what you're experiencing. And also, if you notice family member or friend acting differently and think they might be experiencing some kind of psychosis, just talk to them and kind of use prompt questions to ask them what's wrong, but also sit back and just listen to what they're going through. So the treatment for borderline personality disorder is usually psychotherapy with the involvement of a community mental health team. And these can consist of mental health nurses, psychologists, occupational psychologists, psychiatrists, social workers and pharmacists. And then a CPA is put into place where the individual is assessed socially and environmentally, and then they are given a care plan that suits their social and environmental needs, and then they'll have an appointment with their care coordinator, and their care coordinator is like the key person, the middle person, so they kind of arrange other appointments for their client. So for example, if we had a patient who had a care coordinator, but the care coordinator thought that the person would be best suited with a therapy called DBT, the care coordinator would contact the DBT therapist and their service to try and get an appointment and an assessment booked for their client. So a crisis is when an individual is putting their own life at risk, and sometimes, but this is quite rare, putting others in risk as well. So there's also a crisis team. So they're called whenever there's a severe crisis, and what I mean by severe crisis is if someone's ready to commit suicide, or they're really badly self-harm themselves. And the best thing to do is as well to take them to A&E if they're really badly harming themselves and they're thinking of committing suicide.
Could it be that they want to harm somebody else as well?
Yeah.
In that situation.
It's important to kind of bring 999 as well.
So psychosis can And do you know what about psychosis?
Yes, psychosis, that's like hallucinations and delusions.
Okay.
This is when the individual thinks they can hear things that aren't actually there, and sometimes they feel as if they can smell things or taste things that aren't there.
Right.
I mean, most people with mental illnesses, they're more likely to be a victim of a violent crime rather than, hurting someone else.
Could that be also drug-induced, like excessive drugs?
Of course, yeah. You can get drug-induced psychosis.
Right.
So like the
Cannabis psychosis, for example.
Pardon?
Cannabis psychosis.
Yeah, so kind of like the drugs trigger the mental illness.
Right.
Like the mental illness may have already been there, but it might not be triggered.
Right.
Does that make
Yeah, I know
sense?
exactly what you mean. Yeah. So a person could have stopped taking drugs, for example,
Yeah.
and psychosis could have developed much later. Is that what you
Yeah, maybe, yeah.
Maybe.
Yeah. Like every individual is different as well.
Of course.
Yeah. So self-harm and suicidal thoughts. Self-harm, it's used as an emotional release and a coping mechanism by the individual intentionally hurting themselves. And the reason is, they want to die, they want to punish themselves, and they can't live with the emotional pain anymore. So the types of self-harm: cutting, burning, like with a cigarette, hitting, punching, slapping themselves, poison, and this could be like drinking bleach, and again alcohol and drugs. The suicidal thoughts, these are when constantly the individual has thoughts that they want to end their life. They feel worthless as well at the same time. They feel isolated. There's been a breakdown of relationships. Sorry, let me start that again. So self-harm and suicidal thoughts could be triggered by feelings of worthlessness, alcohol, drug misuse, feeling isolated, a breakdown of relationships, genetic. So if a family member has committed suicide or self-harm before, you're more likely to do so. It doesn't mean you will, but it's just you're more likely to. Previous traumatic events, abuse, neglect, debt, seeing a close family member, friend with suicidal behaviours, and kind of not seeing the light at the end of the tunnel. And that's why it's so important to talk, because everyone can be someone's light at the end of the tunnel. However, you're more likely to have these thoughts and feelings if you've already got a mental illness, so such as depression, schizophrenia, BPD, and bipolar disorder.
Can I just say something? It's very difficult for someone to get help if they don't recognise they've got a problem. So, for example, like a drug addict or an alcoholic, addiction in general, it's for them. The addiction isn't the problem, it's everybody else. So how do you help people who you can see have got a problem, but they don't recognise it themselves? How can you help someone that doesn't want to be helped?
Yeah, I think again the main thing is to listen maybe, and kind of listen to how they're feeling and prompt some questions about how they're feeling, and look out for warning signs, which I was going to go into next.
Okay.
But I think in most cases the individual has to be helped to receive the help.
No, the onus is on them as well. It's not just on everybody around them. They've got to recognise that they've got a problem. But it's very difficult for someone who has got a problem to recognise it themselves. So, for example, depression. It's an illness that tells you you're not ill. Depression wants you to stay depressed. So how do you get them out of that cycle? I know you're saying talk and therapy, but
they don't want to talk.
Kindness and patience only stem so far before they start kind of, I don't know, impacting your health.
That's true.
So you need support for yourself to help that other person.
Yeah, and I think that's why it's so important we talk to each other.
No, I completely understand. You're talking about a massive cultural shift. Like if I look at my parents' generation, not all, most, don't understand what depression is because they've always had a stiff upper lip and they just learn to shove it under the carpet and carry on. So it's difficult, like you say, talk to family, but family might not necessarily understand, and with all the goodwill in the world, family mean well, but they can say the wrong stuff, which can trigger certain emotions in that person that's having suicidal thoughts or an addiction or those kinds of things. So
and definitely the cultural end of it does play into it.
Yeah.
But I think the main thing is the lack of knowledge. Because they don't have that knowledge, they kind of stick it to say black magic, for example.
Yeah, they look at it like, someone's cast an evil eye over them, dona jadoo and all that kind of stuff. So, so it can't be mental illness, someone's done it to them.
Yeah, and like hopefully in the future, like I have to speak with Baji as well, maybe we can get this done in Punjabi as well, and kind of get our elders in here and get, increase their knowledge as well.
Yeah.
So some warning signs for self-harm and suicide. Some warning signs for self-harm, so unexplained cuts, bruises on wrist, arm, chest, keeping covered, like they're always keeping covered, even in like really hot weather, a lack of interest and motivation, and like being withdrawn and low self-esteem. So some other warning signs that may not be as obvious, so reckless behaviour, intense anger, hopelessness, self-harm, withdrawn, agitated, unusual sleep pattern, a loss of interest, not taking care of their personal experience. And it's really important to notice if an individual starts saying their goodbyes and starts kind of apologising for things they did ages ago, or sorting out and giving away their possessions. So things you can do to help a loved one who's thinking about suicide. Encourage them to talk about how they are feeling. Obviously, like we just spoke about that, it can be difficult sometimes. Listen to them and don't invalidate what they're saying. Again, don't kind of brush what they're saying under the carpet. Do it in a non-judgmental, calm, empathetic and loving manner. Ask open-ended questions, let them be in control of the conversation. So again, if your family member, friend are threatening to kill themselves or frequently talk about ending their life, contact their mental health care team. And if you don't have the details, ring your local A&E and ask for the mental health crisis team. So coping with self-harm and suicidal thoughts. If you ever experience these thoughts, talk to someone. Honestly, there is someone there. You're not alone. And Sikh youth are here for you as well to listen to you. By talking, you will realise how many options there are out there for you to get better. There's not just one option, there are hundreds. Talk to your GP, they will help you get access to the right therapies as well. So talking therapies. These are again usually available through the NHS. You can refer yourself to a local psychological therapy service as well. You can do this kind of by just googling literally local psychological therapy service, and it will come up with the numbers and contact details. Talking therapies do what they say on the tin. You talk to your therapist about your difficulties you may be experiencing and the feelings, emotions and behaviours attached to this. And all therapies are different, but most of them will help you recognise and cope with your emotions and feelings. So some of these are CBT, DBT, psychotherapy, counselling, ACT, family therapy and wonder-based therapy. I'll just explain some of these. So CBT is when you set goals with your therapist. It focuses on the present difficulties rather than the past, and it can help with depression, anxiety, PTSD, panic attacks, phobias and OCD. DBT, it kind of has the same approach to CBT, but it's more suitable for those who find it difficult to regulate their emotions and kind of experience emotions really in BPD, as we just spoke about. So you usually would have frequent suicidal thoughts or self-harm as well, and it focuses on accepting your emotions and behaviours and kind of how to deal with them head on. It also focuses on the relationships in the client's life, including relationships between the therapist and client, and there are skills-based workshops within DBT that kind of help you realise the way you're acting out and things you can do to act out in a more positive way. So counselling, it can be used for mental illness, but it's better for those without mental illness and need help with coping with a crisis, like a current crisis such as a loss of a family member or physical illness or like losing a job. So mindfulness, this is a brain training technique, and anyone at all can practice mindfulness. And you don't have to have a mental illness to do this. It helps you manage, and those with mental illness, it helps them manage their mental illness effectively, along with increasing positive mental well-being. So practicing mindfulness consists of being in the present moment, and you can do this with all your senses, and it's also a great technique to use with Nam Jopana to ensure all your focus and attention is on your connection with Vaiguji, because with mindfulness you focus on what your body and mind is going through in the present moment, and you kind of, when you feel as if your mind's wandering, you acknowledge that your mind's wandering, but you bring yourself back to the present moment. So you're fully aware of your thoughts and feelings at that point, so you're able to manage your negative thoughts when they do enter your mind. You can respond effectively to negative thoughts, feelings and events. This manages and reduces stress, anxiety and depression too. Studies have also shown a reduction of addictive and self-destructive behaviours such as drug and alcohol abuse, and an overall improvement of mood, working memory and attention. I mean, all these benefits kind of don't happen straight away after one session of mindfulness. You kind of got to try and incorporate it into your daily routine to see the differences. So now I've got like a little activity for you guys to do with mindfulness. So if I just pass these out. Okay, so if everyone could start blowing the balloon, but okay, so whilst blowing the balloon, every time you exhale into it, think of a negative thought or feeling. Think of a negative thought or feeling and put it into that balloon. Any fears or insecurities you have, put it into the balloon. While you're blowing it, remember to be mindful, focus on the task.
I've got a lot, Tony. I might need another balloon.
Mom,
This negative thought doesn't want to go with it. No, now कितना है?
I'm really liking this.
oh, too much. And then you could try it once you're done.
Same thought. So on every breath a different thought, yeah?
Yeah, any insecurities you have, fears, feelings. And I forgot to mention, what you're doing is let go of any judgment and kind of just focus. Okay, and then kind of just tie it once you're done. So now, whilst remembering all your thoughts and anxieties and fears are in the balloon, I want you to kind of just push it away from you, throw it, however you feel comfortable. So just push it away from you, throw it away from you. Okay, and whilst throwing it, think about all your negative thoughts and feelings
give the whole back.
and as the balloon's going away,
Can you repeat that for us, something?
yeah, so as we said, all your negative thoughts and feelings were in the balloon. So as you throw it away, you're meant to imagine all your negative thoughts and feelings also flying away with it and getting further and further away from you. So, I mean, I wanted to ask you guys how you felt after that, if you felt lighter or if you've seen a difference, but...
Felt a bit dizzy.
But yeah, I mean...
I think it kind of lightened the mood, like everyone kind of got happy and,
yeah, that's,
you know, smiling and stuff.
I tried to kind of put it in after that because it can be quite dull, you know, it's with like suicide and stuff.
Yeah.
But, so yeah. But I think if you practice, you don't have to do this. There's so many different mindfulness activities you can do. I mean...
I was going to go home and like buy something and give it to the whole family.
Yeah, you can do that if you like, but so like a really simple one is kind of just sitting in your chair and closing your eyes, just taking a minute out of your day, close your eyes and breathe like normal and focus on your breathing and kind of notice where all your breath is it in your stomach, is it in your chest, is it in your throat, and kind of just focus on that. And if you can feel your mind wandering, that's fine, acknowledge that, don't judge that, don't judge your judgments, and kind of just bring yourself back into the room and focus on your breathing again. Okay. And then, so the next bit is all about keeping a healthy mind is key. So, Shri Psychology describes our everyday emotions of anger and happiness, as well as sadness. Sadness and depression is often referred to as dukh, and happiness is described as sukh by the Shri Psychology. Meditating, studying Simran, and connecting with Vaheguruji through Nam Japna helps to decrease our stress, low mood, anxiety, and will give you sukh. And like mindfulness comes into this as well, because when you're connecting with Vaheguruji, you want all the focus and attention on that. Also doing seva, so volunteering can help improve our mental health, and there are a lot of studies out there that show by those who believe in God and pray, they do have less stress and anxiety levels, and also with volunteering, those who volunteer have less anxiety. So we're going to kind of move on to the attitudes in our community now, and I kind of just put these up because these are some of the things you may hear in our community, like just some of them. I mean, I've definitely heard some of them. I don't know about you guys, but yeah, and I wanted to kind of go through the different things that affect, the stigmatized attitudes we have in our community. So, like loads of people mix culture and religion together, but when, being Punjabi and Sikh are kind of pretty much separate. So, like in the Punjabi culture, we have those superstitious views as, black magic, but whereas in Sikh, we are totally against it. So, if you're Punjabi and Sikh, it can be kind of, contradicting in a way. So, some families are more in tune with their Punjabi culture than Sikh. So some individuals might find it hard to reach out because they think their family's going to kind of stigmatise them. Punjabi families are always there for each other. We're tight-knit and we have a strong sense of community, which is great. So why is it when we talk about mental illness, not all, but some family members just don't want to know and push it under the carpet? And on the other hand, if individuals say going through cancer, the family would be there 100%. So obviously shame-focused attitudes, beliefs on how the Punjabi community views mental illness and how the community will react if they were to find out the individual had a mental illness, and how the family would react as well. But there's also an aspect of internal shame, how the individual feels towards themselves about having a mental illness. And there's also like social norms to do with gender. So men in particular find it difficult to speak out due to them feeling ashamed and not being manly enough. They are seen to be strong and physically and mentally in the Punjabi community. So reaching out could be seen as a weakness, but that's completely not true. Reaching out is the best thing you can do and the strongest thing you can do. Also in the Punjabi culture, there's a lot of drinking involved. So if you were to go to someone, I'm not saying everyone's like this, but some people, you were to go to them and tell them about your problems, they might tell you to have a drink, the drink solves everything mentality, but this is probably going to make it 10 times worse. After blocking your feelings out with the drink, you'll like that feeling of blocking out your negative emotions, so you'll want to keep drinking, and this can lead to addiction. It doesn't always, but it can. You're more likely to. And then finally, like as Sikhs, we're meant to be shared, and that's great. We are fearless and strong, but everyone gets down sometimes, and that's okay. And it's okay to talk about how you're feeling. It doesn't make you any less of a share to speak out. In fact, it makes you a stronger share to speak out. So ways we can decrease the stigma towards mental illness. So again, it all comes back to talking. The more we talk and educate ourselves, the more we'll understand the psychological aspects behind mental illness, which will hopefully then decrease the stigma-related attitudes. By decreasing stigma towards mental illness, individuals will feel more comfortable to reach out and talk about their feelings. And again, listen. Most individuals are suffering with emotional pain, and they just need to share how they're feeling, and we can support each other by simply taking a minute to listen. And there are like 3 simple words you can use. Are you okay? If you can see someone they're a bit down or not themselves, just ask them if they're okay. It is simple. And stop using mental illnesses as addictive. So for example, someone may say, oh my gosh, I'm so OCD sometimes. No, you're not. You don't have the illness. You're just a bit of a perfectionist. And then another example, oh my gosh, the weather is so bipolar today. No, it's not. How can the weather have a mental illness? The weather isn't a person, is it? So, you know, together we can decrease the stigma. Yeah, that's it for me. Thank you for listening and coming today. Really appreciate it. I'm sorry if I kind of stumbled on my words and if I said anything wrong. But yeah, if you have any questions, I'll try and answer them.
No, just making you aware, so the police and the NHS are working together, particularly around mental health, obviously being really high on the agenda around the government. Yeah. There's a new phone line number, which is 116 123, which is a 24-hour line if people want to speak to somebody who's neutral. So certainly a case of, obviously within our community, it's very hard for us to speak to our family members of something very close to ourselves. So if there's a neutral or you want to speak to that number, or obviously this Sikh youth who can certainly support the work that they're doing around that, certainly get in contact. So that's a free 24-hour new hotline just come out this week actually from the government. So yeah, use that.
Yes, Benji?
You know, with Benji, you know, with mental illness, like, is it DNA related or is it just like developed because of something that happens in your life?
It can be both. It can be genetics as well as like a traumatic experience you may have had. I mean, it depends on the individual again. It all comes down to the individual and the mental illness. So I'm thinking of an example. So for example, depression, you are more likely to be depressed if you have a family history of depression, but it doesn't mean it doesn't always mean you'll develop depression just because, say, your mum or dad had it.